Hello everybody. This lecture about a nutritional assessment. So the objectives of this lecture will be understand the meaning of a nutritional assessment and its main purposes, describe the methods used for a nutritional assessment and their applications, and take short notes on the energy requirement. So at the first, what is the nutrition? Nutrition is defined as the science that deals with the interaction of nutrients and other substances in the food in relation to maintenance, growth, reproduction, health, and disease of an organism. Unhealthy diet can cause deficiency related disease, example blindness, anemia, scurvy, preterm birth, stillbirth, and cretinism. Nutrient excess health threatening conditions like obesity and metabolic syndrome and such common chronic systematic disease as cardiovascular disease, diabetes, and osteoporosis. And undernutrition can lead to wasting in acute cases and the stunting or marasmus in chronic cases of malnutrition. What are types of nutrients? Nutrients in general are classified into two main types. First, the macronutrients, which are needed in large quantities and include the carbohydrates, the fibers, the fat, the protein, and the water. Macronutrient, excluding the fiber and the water, provides structural material such as the amino acid from which protein are built and the lipid from which cell membrane and some signaling molecules are built and the energy. The second part of the nutrients are the micronutrients, which are needed in small quantities such as the vitamins and the minerals. And this picture shows the macro and the micronutrients. But about now we will talk about the nutritional assessment. So what is the meaning of nutritional assessment? Nutritional assessment can be defined as the systematic process of collecting and interpreting information in order to make decisions about the nature and the cause of nutrition-related health issues that affect an individual. What are the main purposes of a nutritional assessment? First, identify individuals or population groups who are malnourished. Second, identify individuals or population group at risk of becoming malnourished. Third, develop nutritional interventions and healthcare programs that meet the community needs. And finally, measure the effectiveness of the nutritional programs and intervention once initiated. Nutritional status is the result of many interrelated factors, example, food intake and physical health. Spectrum of nutritional assessment separated from undernutrition to obesity, and some other qualitative abnormalities in nutritional status may result from change in the body level of certain nutrients, example vitamins and minerals. What are the methods of nutritional assessment? There are two main types of methods. First is the direct method, and this method concerns with individual person and measure objective criteria, and it includes anthropometric measurements, B biochemical assay, C clinical assessment, and D dietary assessment. For the indirect method, it includes use of these community health indices that reflect nutritional influences. They include ecological indicators such as crop production and livestock number, socioeconomic factors, example per capita income, population density, and social habits, and vital health statistics, example infant and under 5 mortality and fertility index. Anthropometric measurements. Anthropometry is the study of the body measures, example height and weight and body proportions such as body mass index. It is an essential component of routine clinical examination of infant, children, and pregnant women. It is used to evaluate both under and overnutrition. The measured value reflects current nutritional status and don't differentiate between acute and chronic changes. A number of measurements are required to form a more reasonable assessment. Main anthropometric measurements are height for age, weight for age, percentage weight change, which is equal to current weight minus previous weight over current weight multiplied by 100. Body mass index, which is equal to weight in kilogram over the height squared height in meter. Waist to hip ratio, and waist to hip ratio is equal to waist circumference over the hip circumference. Waist circumference also include mid upper arm circumference, which involves measuring the circumference of the midpoint on the upper arm using a tape measure. Skin fold thickness. Skin fold calipers can be taken at 4 different sizes: suprailiac, subscapular, biceps, triceps, which is the most commonly used. And this table shows the measurements of anthropometry. This is an explanation of the body mass index, and it can show undernutrition, underweight, healthy weight, overweight, or obese. This is an example of picture for the waist circumference and the hips circumference. This for the mid upper arm circumference, and this is for skin fold thickness. The second direct method for the assessment is the biochemical assay. And laboratory tests based on the blood and the urine can be important indicators of a nutritional status. Lab results can be altered by medications, hydration status, and disease status, or other metabolic process like stress. Thus, biochemical data need to be interpreted in conjunction with a clinical examination, previous medical history, and the current medications. Specific lab tests include hemoglobin estimation, which index of overall nutrition as it measures the anemia, the protein, and the trace element in nutrition. Stool examination of and or intestinal parasites. Urine dipstick microscopy for albumin, sugar, and the blood. And measurement of individual nutrient in body fluid, example serum retinol, serum iron, urinary iodine, and vitamin D. And detection of abnormal amount of disease-specific metabolites in the urine. And the analysis of the hair, nails, and the skin for micronutrients. Clinical assessment. This includes clinical data provides information about the individual medical history, example acute and chronic illness, and diagnostic procedures, therapies, or treatment that may increase the nutrient needs or induce malabsorption. Current medications also included in clinical assessment, both the prescription and over-the-counter medications, vitamins, minerals, and herbal preparations also need to be reviewed. And physical signs of malnutrition can be documented during the nutrition interview and are important part of the assessment process. Symptoms with impact on nutritional status: altered bowel movement, which can lead include diarrhea or constipation; upper gastrointestinal upset, which include reflux, bloating, nausea and vomiting; early satiety, dysphagia, lethargy, and fever. Essential clinical signs of nutrient deficiency include pallor on the palm of the hand or conjunctiva of the eye, which is signs of anemia; pitted spot on the eye, which is signs of vitamin A deficiency; pitting edema, signs of albumin deficiency or fluid overload; goiter, signs of iodine deficiency; and severe visible wasting, which is signs of protein energy malnutrition. This is physical finding in anemia, and here is the pitted spot in the eye. This is an example figure for repeating edema. This is a picture for goiter, and this show severe protein energy malnutrition. And the first type of direct assessment is a dietary assessment, looking at the past or current intake of nutrients from food by individual or a group. Nutritional intake of a human is assessed by 24 hours dietary recall, food frequency questionnaire, dietary history since early life, food diary technique, and observed food consumption. And after we complete the direct method of assessment, we should do evaluation. The clinician use past experience and reference standards to transform the collected data into information that provides an understanding of the individual nutritional status. Anthropometric data can assess ideal and desirable weight. Skin fold measurements can determine body fat. Height, weight, and age used to determine calorie and protein needs. Clinical, biochemical, and dietary data influences on the nutritional status can be determined. And in the evaluation also, a nutritional intervention which usually includes dietary guidance and exercise recommendation is then formulated and discussed with the individual. Now we will talk about the estimating energy requirement. Energy requirement are the amount of energy that need to be consumed by an individual to sustain a stable body weight in the range desired for good health, which is equal body mass index between 18.5 and 25 kg per square meter, while maintaining a lifestyle that includes adequate level of physical activity. Energy is not a nutrient, but it is required in the body for metabolic process, physiological function, muscular activity, heat production, growth and synthesis of new tissue, and it is released from food components by oxidation. Main source of energy is the fats and the carbohydrates. When total energy intake is limited, the body can use the proteins. Ethanol contributes to total energy intake in those regularly consume alcoholic beverages. Energy released from different food items. Carbohydrate or protein give 4 kilocalories per gram. Fat gives 9 kilocalories per gram of fat. And the ethanol gives 7 kilocalories per gram. Energy requirement vary with the age, gender, body size, and the activity, which leads to different recommendations for each of these. What are the major components of energy requirement? The first is for basal metabolism. This involves a set of functions necessary for life, such as cell metabolism, synthesis and the metabolism of enzymes and the hormones, transport of substance around the body, maintenance of body temperature, and ongoing functions of muscle, including the heart and the brain function. Basal metabolic rate is the amount of energy needed for basal metabolism in a defined period of time. Basal metabolic rate represents 45 to 70% of daily energy expenditure, and depending on age, gender, body size, and composition. The second part is the physical activity. This is the most variable determinant of energy need and is the second largest user of energy after basal metabolic rate. Humans perform a number of physical activities including obligatory demands, example occupation, schoolwork, and housework, and discretionary activities, example energy expended for optional exercise, sport, or in additional social or cultural interactions. The third component of energy consumption is the metabolic response to food. Eating requires energy for the ingestion and the digestion of food and for the absorption, transport, interconversion, oxidation, and deposition of nutrient. Those metabolic processes increase the heat production percentage and the oxygen consumption. It known by terms such as dietary induced thermogenesis, specific dynamic action of food, and thermic effect of feeding. It increases total energy expenditure by about 10% of the basal metabolic rate over a 24-hour period in an individual eating a mixed diet. Other special requirement of energy, example in growth also require energy for synthesis of a tissue in the first 3 months of life. Growth uses about 35% of total energy needs. This falls to 5% at 12 months, less than 2% in the second year of life, 1 to 2% until mid-adolescence, and 0 by 20 years of age. Pregnancy and lactation requires also energy to cover the needs of the growing fetus, infant, placenta, and the expanding maternal tissue, and additional maternal effort at rest and in physical activity, as well as the production of breast milk. And thank you for all.